also embrace the digital platform as discussed earlier.
Junet?
Thank you, Chairman. Chairman, my question to Dr. Deborah is, Madam Nominee, as you are aware, health is majorly a devolved function. Health matters happen at the county level. But the problem this country has encountered for the last 10 years or so, since the new constitution and that devolved health functions, is because there is no seamless working system between the national government and the county governments. It is devolved, but you'll see a lot of things are happening at the national level. All the complaints are at the national level, and these things are supposed to be at the devolved, because the dispensary at the village there is what matters. So how do you intend to make sure that health is really devolved and resources are taken to devolved units so that people can get the services at the road there, I mean at the village there? And my last question is, you can see health, the number of medical students also are increasing. And the number is becoming big. There are more health workers that are being trained, even as doctors. But the institutions that are training them now are becoming deplorable, in a very bad state. Do you think that will compromise the quality of healthcare or the quality of services Kenyans get? Thank you very much.
You may proceed to answer.
Through you, Honorable Chair, I would like to respond to the Honorable Member regarding the health, the devolved government. So again, a consultative approach. I believe we need to involve the national team as well as the county government to have open dialogue and come up with interventions. We need to look at the situational analysis and see where are the strengths, the weaknesses, opportunities, and threats. And from there, we need to come up with priority interventions. So I'm coming out of the government, but I believe having open dialogue, having consultations, and coming up to ensure we understand where the national team stops and where does the county begin. Another thing that will ensure seamless flow of information and also to ensure monitoring from national level down to facility level is the health information system, a digital platform, so that the reporting system is picked up and goes to the national level and also trickles down to the facility, as well as tracking and monitoring of infectious diseases, quality of services, and also addressing the matters of corruption. So again, it will be critical for us to embrace the digital platform in this case. Regarding the medical students, what I would say is the health workforce is a critical pillar in health systems. All our health workers are important. The doctors, the nurses, lab technicians, physiotherapists, nutritionists, among other cadres. And let's not forget the morticians and the cleaners who are frequently forgotten. And I think it's critical to say that during COVID-19, we saw that these cadres were actually disproportionately affected by COVID-19 and even other infections like tuberculosis and Ebola. And so we need to strengthen our health workforce. With the numbers increasing, I believe, again, it's a consultative effort. We need to bring unions on board. We need to bring professionals on board, the doctors on board, and come up with strategies and areas of improvement. We also need to strengthen our regulatory system to ensure that we are bringing out doctors and other health workers or professions who are qualified, because we are also thinking of these doctors or nurses and other professions working outside Kenya. So we need to ensure that we are providing quality, top-notch quality and highly experienced health workers that are able or capable to work in the